Well, it's that time of year, pumpkins, corn stalks, everything orange, and Medicare enrollment time. You have until December 7th to get your selections. If you are that age, what do you qualify for? How different is Medicare from regular insurance? Dan Trombley of Paramount Health Care can answer some of those questions this morning. Good morning. Thanks for joining us today.
Good morning, Amanda. How are you?
Doing well, thanks. So yes, open enrollment began last week, right on the 15th, and seniors have a couple months really to get their selections in. But I would imagine for folks who maybe just turned 65, they've got a lot of questions.
They do, as well as people who are on original Medicare or have a Medicare plan now. They've got a lot of questions. People are getting a lot of mailings right now from insurance companies, and they always have, different questions. What plan is best for me? What do I do? Do I have to do anything? So October 15th through December 7th is the annual election period. That's when you can change your coverage. You can add or drop different coverage for your Medicare plans. We've got Medicare Advantage plans available through Paramount. We have 3 in this area that you can choose from. There's several different plan options out there, so it really is best to do some of your homework and find out what plan would suit your needs.
Yeah, and so you guys, when you're talking with clients, I would imagine they've got 2 questions about whether, their plan is good, they're going to be able to keep their doctors, if their, prescriptions can be really expensive. So are these some of the things that you can work through with them?
The number one question we get is, which plan is best for me? And our answer is always, let's walk through the steps. Is your doctor in the network? If that doctor is in the network, then let's go to the next step. Are your prescriptions covered? Are your hospitals covered? What do you need as far as snowbirds or something like that? So there's a lot of different steps to take into account. There's a checklist that we offer all of our potential members and members alike, just to make sure that they're covered with the right plan that they need.
And as you said, you offer Medicare Advantage plans. So these are plans that are kind of replace Medicare, the government program, because you've got Part A, Part B, you've got all these different parts, but these Medicare Advantage plans kind of cover all of that.
They do. Medicare Advantage plans are also referred to as Part C. So you've got Medicare Part A, Medicare Part B, Medicare Part D, and then Part C actually takes the place of original Medicare A and B. And that's kind of like the combo meal. It gives you your hospital, your medical, and your prescription drug all in one plan for a pretty reasonable premium.
Might be easier for people to keep track of it that way.
Absolutely, yeah. Our highest premium plan is $68. Our lowest premium is $0. So there's somebody who wants to enroll in a Medicare Advantage plan, doesn't want to pay anything for it. There's 0 premium options out there for you as well.
There you go. So tell me a little bit about Paramount specifically. You guys here local in the area?
We are. We're in Maumee. Today we're at 1901 Indian Wood Circle. We've got people that want to come in and talk to us face-to-face about their Medicare options. We're taking face-to-face visits. We're unfortunately not doing the large meetings that we used to do during this time of year. What we are doing as an alternative is we're hosting WebEx virtual videos pretty much every week during this time, the annual election period. I'll be doing those. So if you're interested in that, give us a call. We'll sign you up, give you the username and password to log in, and you can join the video. It's actually been a lot of fun. We've seen some familiar faces, so it's good.
Yeah, and obviously you guys are navigating, the pandemic here, so you can't do these, big group meetings as you normally would, but still important to get that information out to people.
Yeah. Exactly.
So you can, as you said, people can call you up there to either be part of these WebEx meetings, or you are doing face-to-face, and people can call and make an appointment?
Yeah, they can just walk in the front door, as a matter of fact, if they want to. They don't have to make an appointment. Some people really want to, just to make sure that they know that they have that date and time on their calendar. But if you just walk in the front door in our Maumee office, our receptionist, Chris, will give us a call. We'll come downstairs. You'll be subject to temperature screening, obviously, with a mask, and during this time, that's what we're doing. We'll be masked as well, and we'll be happy to talk to you about your Medicare options.
And you have until December 7th, but it doesn't mean you should wait until December 7th, right?
Exactly right. So normally, if you're a member of a Medicare Advantage plan, you don't have to do anything if you just want to keep it for the next year. It just kind of it just renews. It's a passive enrollment. If you want to make some changes, if you want to go from one plan to another, from one carrier to another, that's when you have that's December 7th deadline.
Okay, so now's the time if you're thinking, I want to switch things up a little bit. I got more medications or fewer, or, different doctors, now might be the time. You give them a call and get an appointment, or get on one of these calls on the internet, because that's how we're doing things, right? And you'll get all the information, all those questions answered. Dan, thank you so much for joining us this morning.
Thanks, Amanda. Have a great day.
You too. Thanks.